This is chapter 26, supragingival and subgingival irrigation. Supragingival and subgingival irrigation are used to diminish your gingival inflammation by disrupting biofilms. They're a device that delivers pulsed water or another solution supragingivally and subgingivally, also known as oral irrigation, dental water irrigator, home irrigator, or dental water jet. This is what a dental water flosser typically looks like. It has a reservoir for water. You can, for home use, you can add other delivery agents in there like Listerine, diluting it down, so maybe just a couple capfuls of Listerine in the water reservoir. You can set it on how powerful you want it to be. It should be powerful enough to dislodge biofilm, but not powerful enough that it actually hurts. You can also put warm water in it so that you're not shooting cold water if you have cold sensitivity on your teeth. So a patient applied home irrigation or dental water flosser delivers the pulsating fluid that incorporates a compression and decompression phase. It creates two zones of fluid movement called hydrokinetic activity. The two zones are the impact zone and the flushing zone. The impact zone is the initial fluid contact near the gingival margin. And then the flushing zone is the depth of the fluid penetration within a subgingival sulcus or periodontal pocket. So basically what you do is it has a tip, an irrigating tip that comes not quite to a point. And you want to direct your water flow so that it's pretty much at a 45-degree angle on the tooth surface but along the gum line. And you can angle it up slightly subgingivally too. Again, it should be on hard enough to dislodge or disrupt bacterial biofilm, but it shouldn't hurt when you're using it. The fluid penetration, so you can see based on like a toothbrush goes 1 to 2 millimeters. If you were to just take the Listerine and water and swish it in your mouth, it would only go about 2 millimeters subgingivally. Your toothpick, your interdental brushes, it just kind of depends on how much space you have between your teeth. Your floss goes about 3 millimeters. A dental water flosser, as you can see, goes about 6 millimeters down. So that's pretty good depth of penetration to be able to dislodge biofilm. The benefits is that it does dislodge biofilm. It doesn't cause bleeding. So patients generally, your feedback isn't that, oh, I don't floss because I get so much bleeding, or is it supposed to bleed, or I'm afraid to floss because I get bleeding. There's usually no bleeding involved with home irrigation. It reduces gingival inflammation. It reduces the periodontal pathogens by disrupting biofilm. It reduces the inflammatory and disruptive host response. A water floss used with a manual toothbrush removes 29% more biofilm than just brushing and flossing, and daily irrigation with water is significantly better than rinsing with chlorhexidine. The biggest benefit probably is that it makes your gums and your teeth feel really clean, and so oftentimes just that in itself is a big motivator. On the downside, it's messy to use. So I don't know if you've ever used a water irrigator, but if you've got it pulsed up too high and it deflects off of your teeth, it gets all over the mirror. Sometimes when you're rounding the corners, like around your back teeth and coming around from the front, from the buccal to the lingual, the water can spray out at the mirror. It's pretty messy. There's a learning curve with it. Why would you use it? What are the indications? So you can use it during periodontal maintenance, those non-compliant with dental floss, individuals with special needs. It's great around dental implants. It is probably the #1 recommended device that I always had around dental implants. Flossing is great, and flossing is definitely good for dental implants, but I think a water flosser gets in and massages the gum tissue and dislodges the biofilm better. Individuals with diabetes, and then around orthodontic appliances. So it's easy to manipulate around orthodontic bands or brackets. There's a risk is similar to other oral health care devices for bacteremia. Bacteremia is where like bacteria can get underneath into the bloodstream. So when you are like doing instrumentation or even brushing or flossing at home and you get bleeding, bacteria are entering into the bloodstream. And that's important based on certain medical conditions. Irrigating solutions, you can use water or you can add antimicrobial solutions such as chlorhexidine or essential oils. So any of your like Listerine type products that contain essential oils, you can put, I wouldn't use straight Listerine by any means, but you can put a few capfuls and it makes it taste really good too. There's different types of irrigating tips, and you can see there are these tips on this slide. We've got the standard irrigation tip. That's the one that you're most commonly going to use. The delivery solution that penetrated 50% or more of the pocket. Then you've got your special one for orthodontics. It has a soft tapered brush that facilitates biofilm removal around the wires and around the brackets. And then you've got your Subgingival irrigation tip. It has a soft rubber tipped end so that you can slide it into pockets. It allows for deeper penetration up to 90% of the pocket. So I would recommend this one with the rubber tip for patients that have like furcation areas where they have really deep pockets. That's another area that water irrigating is terrific for, is furcation areas, deep root grooves. So around 5 and 12, where on the mesial of the maxillary first premolars, where there's that deep root groove, a patient that is starting to develop some periodontitis there will have a lot of plaque and calculus building up in that area. So it's difficult to manipulate floss. So a water irrigator is perfect for that area. How do you place the tip? You can place the tip at a 90-degree angle for standard. For an orthodontic one, you want to place it at a 90-degree angle also, meaning that you're going to direct the water flow right at the neck of the tooth, so right where the tooth meets the gum line. If you want to use it subgingivally, you're going to hold it at a 45-degree angle, and you're going to slide the rubber tip beneath the gingival margin. And again, usually you have to have a little bit deeper of a pocket to be able to do that. Professional subgingival irrigation systems, they're very similar. The piezo has a separate water bottle. The Cavitron runs off of the water that comes through your unit, your big dental chair unit, but the piezo has its own separate little water bottle, and so you can mix chlorhexidine or Listerine or something within that separate water irrigating bottle for irrigation, but you just have to be careful to make sure that you rinse and flush the water line out so that you don't get that solution can get kind of gummy in the water lines. So just make sure you flush it through at the end of the day. The goal of professional irrigation is to enhance the outcome of periodontal instrumentation by disrupting and diluting plaque biofilm from within the periodontal pockets. So when I used a piezo in private practice, I always put about a third chlorhexidine in it and 2/3 water, and use that, especially on root planing, to help irrigate out the pockets as you're going along. And then after I was completely finished with instrumentation, both on perio maintenances and on scaling and root planing, I went back around and just took the tip under the gum and irrigated it with that chlorhexidine water solution. The effectiveness of professional irrigation is still controversial, but it certainly doesn't hurt. Some believe that it has no limited value at all, but it isn't going to cause any problems either. No substantivity. Substantivity is the ability of a chemical plaque control agent to be retained in the oral cavity and be released slowly over time. So once you irrigate, that irrigation solution runs right back out. Let's see, it would have to be retained in the pocket and be released slowly over time for it to be effective. There's no long-lasting substantivity. Pocket depths and calculus can impede the flow of the solution. So that's why I used to do it when I used to use it. I would do all of my scaling first and then go back and just kind of irrigate out those areas. So even if the solution ran back out and had little value, at least it had some value, and it certainly wasn't hurting anything. There is weak evidence to support the use of professional irrigation, and before instrumentation, it may reduce the incidence of bacteremia. So we have patients rinse with Listerine. Some places would have you do subgingival irrigation before you started your scaling or replaning. Certainly, always when a patient had a periodontal abscess, it could flush irrigation would be good to kind of help reduce some of that bacteria that's about to enter the bloodstream. And that concludes our talk about subgingival irrigation.